I'm the Secretary to the Government of the Federation, honorable ministers, members of the Presidential Task Force, ladies and gentlemen of the press. Good afternoon. So mine will be quite brief because the Honorable Minister of Health and the DG and CDC has already mentioned a lot of the things I was planning to say. First of all, I would like to, on behalf of the PTF, continue to appreciate the patience and understanding of the general public as we continue to work together to protect ourselves and our loved ones. We have noted that some states have started lifting their ban or relaxing their containment protocols. And this is really not the right time to do so, partly because we still have an ongoing pandemic which is global. It is also not the right time to do so because we could end up having a real recrudescence of infections. At this point, I'm appealing to our local community leaders, our religious and traditional leaders, as well as the state authorities to continue to support and encourage the public to maintain those protective measures that are important in getting on top of this infection. There's also a very strong need for state governments to work in harmony and align with the federal government in our effort to deal with this pandemic. This pandemic is not just an Abuja or Lagos issue. It's a national issue. With regards to the Easter celebration, as the DG and CDC said, we would like to remind the public that we're still in lockdown for Lagos, Ogun, and the FCT. The evidence so far from literature shows that the cessation of movement, or otherwise called lockdown, continues to be one of the most effective physical distancing measures when it comes to controlling COVID infection. After all, this is an infection that is invisible. This is an infection that spreads socially. It's a very social virus. It requires close interaction with each other. So if we can maintain that distancing, we might be able to fight it more effectively. In terms of the medical side, again, I would like to ask state governments working through the state task force teams or the state ministries of health to consider setting up accreditation teams that would accredit particularly private facilities, but also public facilities, for the simple reason that it's really important that our frontline healthcare staff know how to use PPE and know how to protect themselves from this infection. We are very keen to expand the availability of intensive care facilities beyond just the public sector. And I'm calling at this point on the private sector, particularly those in Lagos and Abuja, to approach us or to approach their local authorities to get in contact with the accreditation teams that have been formed by the Federal Ministry of Health and the Lagos State Ministry of Health, so that they can accredit themselves and we can start using their facilities in a proper way. Again, I would like to remind both public and private health facilities to please continue to have a heightened awareness of possible cases of COVID-19, and this includes the public as well. If you do notice people having unusual respiratory illnesses or clusters of death related to respiratory tract infection, we definitely will need to know. Thank you very much.